And now I'll just move the floor to the co-chair of the session, Professor Mahmood Adil. Professor Mahmood.
Thank you, Dr. Nahar. It's a privilege to be with you and to support on this session as the co-chair. And I'm also grateful to the organizers to make me as one of the member of the advisory board. So it's a very well thought through conference, and it was really excellent to listen to those two speakers. And we have got this particular topic, health policy, is pivotal, because we know that almost every government or every organizations do have some health policies, but pandemic has tested them out, how effective they have been. So it will be really good to pick up some questions, and subsequently I can have my views on this.
Okay, so now we will thank you, Professor Adil, and we'll go to the questions, and probably I will start with this question from Ben Anthony in Gange. What opportunities will emerge out of the current crisis and eventual recovery for transforming healthcare policies? Probably I'll direct this to Dr. Mike and Professor Adil if you want to reflect on that.
Well, thank you for the question. I mean, I think that we can see that we learned enormously from the experience of the 2009 H1N1 pandemic. Whilst perhaps not a pandemic, I think we learned lessons also from the Zika experience emerging out of South America. And I have every confidence that we will learn again. In terms of the specifics with COVID, I think the need for the collection of good quality clinical information that will allow us to assess the impact of different interventions is going to be crucial. And I'm sure that we will see further investment in healthcare information systems over the next few years that will lead us to be better prepared for the future. I think the other issue that we need to learn about is I think we need to think about supply lines. Supply lines for diagnostics, for medicines, for personal protective equipment and other things. And I think we need to look at how we can actually prepare better for that. Thank you.
Thank you very much.
I think Dr. Catchpole did highlight a very good couple of points, but one thing I saw from his presentation, he mentioned about the three-way of the post-pandemic reviews. They are very, very important because we need to learn in a very objective manner that what has done well and what went well and what didn't work very well. So I think my question to Dr. Catchpole is that, is there any plan by ECDC that we can do that post-pandemic reviews in a very systematic manner in Europe?
Thank you. Thank you for that question. It's an excellent question, and one I'm very pleased to answer because I've got a good answer. Absolutely. We have actually already published guidance. We've also shared with our colleagues in public health institutes around the EU guidance on current best practice in terms of in-action and after-action reviews for exactly the reasons you say, because I think it is terribly important that we learn from these after-action reviews through the systematic collection of data so that actually we can pool the lessons from different settings. So we are advocating that. We've actually already been involved in a couple of in-action reviews with EU member states looking at the response. And I would say that ECDC is not itself adverse to reviews, and actually we're in the process of actually commissioning an external evaluation of our own response as well.
Dr. Nahar, would you allow me to expand on this?
Okay, in fact, I just go back to the model where Dr. Mike, elucidated about the pre-pandemic, during, and post, which is the prepare, respond, and reflect, model. In Saudi Arabia, I can just comment on our, response to the pandemic, where we use the, when it comes to policies, proactive policies, reactive, and supportive policies. For example, in the proactive policies, one of the first, decisions was suspending entry for Umrah, and this is, the impact of this policy or this decision was really very, critical, because, for people who come to Umrah and Hajj to Saudi Arabia, they are coming from all over the world, and once they leave, if there is any, infection or pandemic, this will definitely have a global, impact. And this decision was one of the first, decisions. Also, restricting the movement of the Saudis among the GCC countries. This is even started before, registering the first case in Saudi Arabia. While in the reactive, it's a lot of very aggressive, policies. And in fact, there was a higher policy led by the Minister of Health and the representation of this committee, where all the healthcare sectors, even the non-healthcare sectors, who come up with a lot of, very relevant recommendations related to the lockdown or the, movement restrictions or whatever. Then it will be submitted to the royal court, and it will be almost approved, in a very short time. So there was a lot of flexibility in providing the policies. Then also the curfew, for all the cities, which happened. And I definitely like the reflection part of the presentation of Dr. Mike about the revision of the preparedness. So all of these are areas of consideration in our revision of improving the policies. Professor Adil, do you have another question? Or?
Yes, thank you. I think it's very interesting and rather very, very important that almost 100,000 people from 110 countries are watching this or listening to this. So the point Dr. Catchpole made, or rather I'm very pleased to hear that that there are in-action and after-action review guidance. And one of the purpose of this G20 summit is that we need to be spreading the best practice. It would be really useful to see that how best we can utilize those resources, and we can share it through this platform. So that is on that point. But I would like to say that when we talk about pandemics and their impact on policies, we need to remember that as health policy is very key for every country. But what a pandemic has done, it has bring some of the things to the front. For example, data and digital, but we were collecting a lot of data. And as Professor Kidd mentioned, in Australia, as well as Dr. Catchpole, that yes, we need to be collecting more data. And my argument is we need to be collecting more broader determinants of health data, not just the clinical data. Because you look at the pandemic, it is having an impact on many fronts. And unfortunately, many of the health systems, they don't have enough data outside the healthcare setting. And I think in Scotland, we are very proud of that our data is very integrated. And there are a number of other countries who could learn, and we can work with.
If I might, Mr. Chairman, I absolutely agree. I think that part of the data gathering, determinant data are incredibly important. I mean, obviously, for chronic diseases, determinants are data are essential to our understanding. But if we look at other pandemic potentials, particularly we'll look at zoonoses and vector-borne disease, looking at determinants is terribly important. We know from the experience with Ebola that almost certainly that's being driven in part by changes in land use and deforestation. So determinants is a very broad spectrum of things that we need to collect data on, but I think that bringing that data together with better quality health data will give us incredible insights that will allow us to control pandemics better in the future.
Dr. Nahar, I've got a couple of questions from the audience. Should I ask them?
Okay.
So there's a question from the audience that what are your thoughts on evaluating the International Health Regulation 2005 to improve the international collaboration to revise health policies? Dr. Catchpole.
So, I mean, I think that the International Health Regulations 2005 provide an excellent basis for improving collaboration. I mean, in the first place, what they do is they provide a basis for actually ensuring that everybody is operating at the same level, that there is consistency and hopefully therefore interoperability between the types of information and data that we collect, that there is the capacity to detect and respond to problems at the earliest possible stage. So it's, I mean, I think they provide an excellent foundation for that. But clearly, we also need to go beyond that when we look at the full range of different health policies, particularly where we look at, as I say, supply chain issues, standards for health data interchange. But I think that the IHR still provide a good, solid foundation for that.
Thank you. There is another question. Do you think the current national or international health policies are enough to face any future wave or any future pandemic? I know it's very open-ended, very broad question, but it'd be really nice to have your reflections. And of course, the same I may ask Dr. Nahar, that what is the situation in the Kingdom of Saudi Arabia in relation to those health policies?
So just, if I could just ask to repeat, are there policies? I just missed the word after. What are the health policies?
Yeah, I think it's a very generic word, health policies, rather than health protection policies.
Well, I can't profess to be an expert on all health policies in all countries, but certainly within the context of the EU, there has been a general moving together, a general development of increased consistency and interoperability of our member states' preparedness plans driven by EU legislation on cross-border threats. But there's also a committee called the Health Security Committee, where the health administrations of all the EU member states come together on a regular basis and talk about coordination of measures and response. So I think that initiatives like that can really help to improve our ability. And the Health Security Committee is not confined to talking about infectious diseases. I mean, it is, although it does talk primarily about cross-border threats, but cross-border threats are not only infectious. So I'm an optimist. I believe that we learned from 2009. I think that the structures have been put in place since SARS, of course. SARS was a watershed event, really, in terms of investment in organizations like ECDC, like the one I work for, and in developing international legislation that will drive improvements to that. So I'm an optimist, and I think that the answer is yes. I think that health policies are moving in the right direction, certainly from where I sit within the EU.
Thank you. Dr. Nahar, you are in a very key position within the Saudi Health Council. How do you see the direction of such policies in Kingdom of Saudi Arabia?
Thank you, Prof. Adil. In fact, the Saudi Health Council is a regulatory coordination body. The council is chaired by His Excellency the Minister of Health, and the members are the leaders of the healthcare providers and the special regulatory entities in Saudi health system. And in our vision, we are looking for an international standard healthcare system to really reflect on the quality and the safety and the efficiency of the system. Probably you know that the whole system, healthcare system in Saudi Arabia is passing through a very aggressive transformation as part of the Vision 2030 projects. So one of the models which we are seriously looking is the governance model of the Saudi health system. So we know now that we have multiple regulators in the health system which produce multiple policies, and now part of the transformation is moving to less number or even one regulatory body, for the health system. But definitely the interest is to move towards more of evidence-based policy, integrating the human behavior towards a healthy lifestyle. The whole system is moving towards a value-based healthcare, which ensure that there will be a higher level of safety, quality, and also efficiency.
Thank you.
Thank you. So I know that probably we are now supposed to finish here at the end of this session. I want to thank you very much, Dr. Mike Catchpole and Dr. Michael Kidd, and also thank you very much, Professor Mahmood Adil, for co-chairing this session, and thanks also for the organizing team and all the participants who were following this session. Thank you very much, and I'll leave it for the next session. Thank you.
Thank you.